Okay, good morning and welcome again. I'm going to introduce you to nursing science. Like Dr. Becker said, occupational therapists can fit in everywhere, nurses can fit in everywhere and anywhere. So nursing is all about care, but nursing is also a science. It is a service to others and the self. So if you choose nursing, remember that many times it will be required from you to serve others, but that is because for some time they cannot help themselves. So you must feel passionate about what you're planning to do. Also, there's a lot of knowledge and skills involved in that. You know, knowledge are developing every day, and we also have to keep up to date with the newest developments in nursing. And there's a lot of skills involved, so that's why we also need the clinical hours. And in nursing, you need 4,000 clinical hours, which is quite a lot. So our students are required to work every week, but usually they enjoy that a lot because that is an application of the knowledge that you learn in class. There's a lot of teamwork involved with all the healthcare professions. You work together with other professionals, and you need to have that skills to be able to communicate with others and work together with others. Nursing is a career with many opportunities. If you don't fit in with a specific discipline, you'll find that you fit in somewhere. I did not want to do nursing. I don't know how I ended up here. It was not my plan. But while I was studying, I found something where I fit in, and that was psychiatric nursing. And I'm passionate about that. And I'm so glad that I did that because I'm enjoying every minute of my work. And every day I feel I can find something to do for someone else. So if our students qualify, they can specialize in general nursing, okay, and that is nursing with people with different needs in hospitals, clinics, and private practice. So like the other disciplines, you can work in a hospital, you can work in a primary healthcare clinic or in private practice. And medical surgical nursing, which is the general nursing part, is more what we call general nursing. If a person goes for surgery, if a person has got a medical condition and need specific help with that, then that's the area to specialize in. Our nurses also qualify as midwives, and that is care for the needs of the mother and the baby before, during, and after birth. So we find that many students come and tell us, I want to be a midwife, and that's their passion, why they do nursing. But like with the other disciplines, you also need to have that basis. You first have to know how to nurse before you can specialize in midwifery. Because all the medical conditions can apply to the mother and the baby, and one need to have that basis before you can specialize. And the midwifery is usually done it's actually done from the second, third, and fourth year. So these are some of the questions that we often get. So nursing is a 4-year degree. There are some bursaries available. The Department of Health is helping us with that. Unfortunately, nowadays they only give, for the University of Pretoria, only students from Gauteng, because the other provinces have their own bursaries. But there are many other options as well. For example, this year we received a number of bursaries from private hospital groups. And, you know, they also have a lot of benefits if you make use of those bursaries. Also community service, as for all the other health disciplines. So we cover a lot of theory during the course. And it's not only the lecturers of the nursing science department, but also other departments, like we also have anatomy subject, physiology, microbiology, pharmacology, all those fundamental modules need to be covered. And the classes are at this campus, which we call Prince of Campus, and also close to the hospital, in the hospital, and some of the classes are at Hatfield campus as well. And then for the practical hours, now often we see nursing as being in hospital. Nurses are located in a hospital, but we also do a lot of primary health care where the nurses work in the primary health care clinics in the whole area and the Tshwane district. So they're also exposed to preventative health care, which is a very important part of health care, that we do not only want to cure and rehabilitate, but we also want to prevent major illnesses from happening. So the clinical learning or the practical courses then takes place in the Tshwane District Hospital, which is close to this area, the Steve Biko Academic Hospital, where there's a lot of specialities and a lot of learning take place in the Steve Biko Hospital. We're also now accredited Kalafong Hospital, where there's also a lot of opportunities for our students. And like I said, the community healthcare clinics, where the nursing students obtain a lot of practical experience. And also the psychiatric hospitals. We make use of public hospitals as well as private hospitals to give our students more exposure to the different disciplines and areas of nursing care practice. Okay, so like I said, a lot of opportunities in nursing. You know, if you can persist, you do your 4 years and you qualify, then the world is open. You can work anywhere. So there's trauma or emergency nursing for those nurses who like the excitement and the technical aspects of nursing. They can work in the field. They can work in the hospital. Then we've got intensive care nursing, which many nurses also like to specialize in that, which is very technical, very intensive, very hard work. And you really need a lot of technical and theoretical knowledge to be able to do the intensive care. Then there's theatre nursing, which some people also find very exciting. And it also, you can specialize in any of these areas. You can work in those areas after the basic 4-year course, but you can then choose to specialize and do postgraduate courses in any of these specialization areas. Psychiatric nursing as well. You want to work in a psychiatric hospital, also primary health care. There's a lot of opportunities in psychiatric nursing care and in rehabilitation aspects. And then midwifery, which, like I said, can be done before the baby is born, during the process of the delivery, and also postnatal care. Okay, then I've mentioned the medical surgical nursing, I've mentioned the primary health care, and then there's also possibilities of advanced practice. So in nursing, we offer the master's degree in nursing, also by virtue of dissertation and by virtue of coursework, where you obtain more practical experience in that specific speciality. And we are in the process of also doing the curriculum changes that we can offer the advanced diploma. And we can offer a master's degree in all the speciality areas. Then also nursing education, like for now I specialized in nursing education. There's also a lot of opportunities because there's many nursing colleges and some of the hospitals also employ people that specialize in nursing education for in-service training and training of nurses while they work in the hospital. You need continuous training. And then there's also nursing management, which some people do the management course in nursing, specifically in nursing, and then they're able to become unit managers, even hospital managers, clinic managers, or managers in the Department of Health or in private practice. Okay, so that is that. I can maybe also just add that you, after specializing in your master's degree, you can also do PhD in nursing, and nurses can, you will never be without a job. Wherever you go, there's there's a need for nurses, and international, national, to be able to work overseas, you need sometimes to upgrade or to, not really upgrade, but maybe register at the Nursing Council of that specific country and write a special exam, but the world is open. You need to have that special feeling for others, that caring feeling. And we also ask, if you want to apply for nursing, make it your first choice. If that is your passion to help other people, and don't use it as a stepping stone to get into another course, because we're also, proud of our profession, and we really want nurses who are passionate about caring for other people. And I must say, we've received many qualifications, more than we can take, we train the best nurses in the country. Thank you.